Hello everyone, welcome to my YouTube channel Logic Medico. Today's topic for presentation is medical terms used in neuro. So what are these medical terms and what are the meanings of this we'll see in this video. Before going to the actual content, you should know the neuron are one of the type of the cells which are present in nervous system. Neuroglia are the supporting cells for these neurons. They insulate the neurons. Neurons will have electrical activity, but these electrical activity are prevented from going to different types of neuron by neuroglia, so they actually insulate them. So these neurons have got following parts. The largest portion of the neuron is called the cell body. The number of cytoplasmic processes which are thorn like projection closer to the cell body receives the nerve impulse and is called as dendrites. A single cytoplasmic process is really long. The terminal buttons and surrounded by myelin sheath is called as axon. These are the parts of the neuron. With this basic idea, we'll see what are the various medical terms used in neuro. So what is this word neuro? It's a Greek word. It means it is related to the nerves or the nervous system. So these nerves are the entire nervous system. So nerves are a bundle of myelinated axons outside the CNS. You can see my one more video based on differences between various similar terms used in nervous system. The link is given in the description. And the other word is nervus. It's Latin word. Nervus means anything relating to the nerves or affecting the nerve is called as nervus. Okay, there is a central nervous system which is the brain and the spinal cord. Central nervous system. The cranial nerves coming out of the brain, the spinal nerves coming out of the spinal cord come under the heading called as peripheral nervous system. There is one more nervous system which works by itself. It is called automatic nervous system or the autonomic nervous system. As the name suggests, it works by itself. There are two among them, sympathetic and parasympathetic. Sympathetic is the nerve of emergency, whereas parasympathetic is the nerve of calmness. So if you see the various terms is neural. So what is neural? Anything pertaining to the nerve is referred to as neural. So that is the meaning of neural. Neural process, neural impulse, meaning the information, sensory information coming from the skin to the brain. It's called neural impulse. So from the brain and spinal cord, if it's going to the periphery towards the muscle or the gland, that is efferent impulse. It's going away from the one which is going sensory information from the periphery towards the CNS is called as afferent impulse, neural impulse. Afferent, neural impulse. Afferent, A-F-F-E-R-E-N-T. Afferent means towards the CNS. Efferent means away from the CNS. They are called as neural impulses. It's pertaining to the nerve. Neurology. Logy means what? Logy means study. So the study of nervous system is termed as neurology. So the person who studies the nervous system and all together it's called neurology. If you are taking the neurology book, it will be given in detail with respect to nervous system. Neurologist. So what is this neurologist? Someone who studies the nervous system will be called as neurologist. Rather than this, so most of us study the neurology and later we apply that in our day-to-day life. But actually, the neurologist refers to a doctor who has done super specialization in the nervous system. So after his MBBS, he has done MD medicine, then he has done DM neurology. That person, the doctor, is called as neurologist. More often than not, it is used for that scenario to refer to the doctor who is specialized in nervous system. It's called as neurologist. Neurosurgery. Any surgical procedure involving the nervous system or the nerves will be called as neurosurgery. What will be neurosurgeon then? The person who has done MBBS and then MS surgery and specialized in doing operative procedures with respect to nervous system is called as neurosurgeon. Neurosurgeon is specialized in neurosurgery. In road traffic accident, head injury will be there. He will open up, remove the clot, various surgical procedures to remove the tumors from the spinal cord. All this is done by neurosurgeon. Neuron. Neuron is a structural and functional unit of the nervous system. In the beginning also we saw parts of the neuron. The electrical activity will be there in the neuron. The dendrites receives the electrical impulses towards the cell body, whereas the axon sends this nerve impulse away from the cell body. This nerve impulse is also called as action potential. It's an electrical potential, electrical activity. So neuron belongs to nervous system. It is a structural and functional unit of the nervous system. What is neuroglia then? There are so many neuroglias. For example, astrocyte, which appears like star shape, oligodendrocyte, which forms few cytoplasmic processes and helps in the formation of myelin sheath within the central nervous system. Microglia, which acts as a macrophage scavenger in the central nervous system, eats up the foreign agents which come into the gains access into the central nervous system. Microglia will eat up that. It acts as a macrophage of the CNS. Ependymal cell, which forms the lining epithelium of the central canal on the ventricles of the brain, central canal of spinal cord. This astrocyte is important. It forms the blood-brain barrier, so-called BBB. The Schwann cell forms the myelin sheath in the peripheral nervous system. So all these neuroglia actually supports the nerves which are there. So there are two types of cells in our entire nervous system. One is neurons, the other one is neuroglia. So glia is actually gluing the cells of the nervous system. They are the supporting cells of the nervous system. They are called as neuroglial cells or just called as glial cells. They form the myelin, they protect the neurons, they support the neurons and maintains the equilibrium, also nourishes the neurons. So they maintain the internal, these are the functions of the neuroglia. Forming the myelin is usually oligodendrocytes in CNS and Schwann cells in the peripheral nervous system. Protection, every neuroglia tries to protect the neuron. Supporting framework, it acts like a cushion between them, maintains equilibrium, that is internal environment, by removing the waste products. What is the meaning of the word neurovascular? Vascular refers to blood vessel, neuro refers to nerve. So usually they run in a bundle anywhere in the body. They usually run in a bundle. It's called as neurovascular bundle, meaning a nerve will be running along with the artery and vein, will be called as neurovascular bundle. There are so many examples of neurovascular bundle. For example, axillary neurovascular bundle, where there will be axillary vein, axillary artery, and trunks of brachial plexus, cords of brachial plexus along with the branches. Trunks later becomes the cords after the division. So along with that there will be formation of sheath called as axillary sheath. Neurovascular just refers to a combination of nerve and blood vessels. So there is another example, popliteal neurovascular bundle, where popliteal vein will be behind the knee joint, popliteal vein, popliteal artery, and tibial and common peroneal nerve. They form together popliteal neurovascular bundle. So whenever someone refers to neurovascular bundle, if there is a damage to the neurovascular bundle, if some surgeon is telling that, that means there is a damage not only to the nerve but also to the blood vessel, that is the vein and the artery, and the blood supply to that area is also compromised in addition to the nerve supply. That's what is the meaning of that. Okay. Next, coming to the word neuronal, as the name suggests, the neuron, one neuron is there, another neuron is there. The junction between the two neurons, it's more appropriately called as synapse. So the junction between the two neurons is called as synapse. There can be various types. The most common type is this one. There is a terminal button axon, and this is soma of the cell body. It's called axosomatic. It can be between the axon and dendrite. Axodendritic. It can be between dendrite and dendrite. Dendrodendritic. It can be between the axon and axon. Axonic. These are the various types of synapse possible. Whenever the word neuronal is used, that means the junction between one neuron and another neuron. It's nothing but synapse. The gap between the two neurons is called a synaptic cleft, where the neurotransmitter will be released by the presynaptic neuron. It will act on the postsynaptic neuron to bring about the effect, either the stimulation of the postsynaptic neuron or inhibition of the neuron. Next, the word neuromuscular. Neuro means nerve, muscular means muscle. It can be skeletal muscle, smooth muscle, or cardiac muscle, but the junction between the two is called as neuromuscular junction. The junction between the nerve terminal button and the muscle fiber is called as neuromuscular junction. Acetylcholine is a neurotransmitter which is released. It will act on the acetylcholine receptor on the muscle and bring about the effect in the muscle, that is sliding of actin over myosin to bring about the length, reduction in the length of the muscle fiber, that is called as contraction of the muscle. So it's simply termed as NMJ, neuromuscular junction. The junction between the nerve and the muscle is called like that, neuromuscular junction. Next word is neuritis. Itis means inflammation. Inflammation of the nerve will be called as neuritis. So usually diabetic will have peripheral neuropathy or peripheral neuritis, inflammation of the peripheral nerve. So in the feet and in the hand, they have loss of sensation or paresthesia or anesthesia. That means they have peripheral neuritis. In Guillain-Barré syndrome, posterior column tract of the spinal cord is involved. they will also have peripheral neuritis. Neuralgia. Algia refers to pain. So pain which is mediated by a nerve or derived from a nerve actually is called as neuralgia. So there are various types of pain. Muscle pain, myalgia we call. Pain is derived from a muscle. Arthritis pain. So pain from a joint. Pain which is derived from a nerve because of a nerve tumor or an inflammation is called as neuralgia. Algia means pain. Neuro means derived from a nerve actually. What is neuropathy? So pathy means disease. So disease of a nerve is called as neuropathy. For example, peripheral neuropathy means peripheral nerves are affected either in the hand or the feet. It's called as peripheral neuropathy. Symmetrical neuropathy means both the sides are equally affected. Symmetrical. Asymmetrical neuropathy where one side is affected. For example, one hand is affected while the other hand is normal. So that is called neuropathy. In diabetes, usually most common illness. So diabetes, neuropathy is common. Diabetic neuropathy, the disease of the nerve because of diabetes. That's the meaning of diabetic neuropathy. So it can also affect auditory nerve. So it can cause sensory neural hearing loss. Or a disease of entire nervous system can also be called as neuropathy. So that's a broader term. Neurogenic. Genic means beginning from. So if beginning from a nerve means neurogenic, beginning from a nervous system. Neurogenic. Neurogenic type of pain, neurogenic pathway beginning from the nerve. That's what is the meaning of that. Next, neuroma. Oma refers to a tumor, a growth, a neoplasm, a new growth. So that growth, if it is beginning from a nerve, it's called as neuroma. It's a tumor or a swelling arising from a nerve or a nervous system. It's called as neuroma. Okay. So it can be two types, a benign tumor or a malignant tumor of the nervous system, but the term neuroma, oma is a suffix for a tumor. But tumor won't happen in the nervous system, right? Because neurons won't divide. That's what we all think, correct? Neurons won't divide. It's correct. I'm not disagreeing with that. But another group of cells is there. Just now today only I told you, neuroglial cells. These cells have the ability to divide. So when they divide, uncontrolled, irreversible, non-coordinated growth of these cells will result in tumor. Best example, schwannoma, oligodendroma, medulloblastoma. All these are tumors of the neuroglia tissue. Since the neurons have lost the ability to divide, that's why whenever there is damage to the entire neuron, not the tail of the neuron or the axon, when it grows, it will regenerate. Wallerian degeneration and regeneration can happen. Talking damage to the cell body of the neuron, it will not be able to grow because it has lost the ability to divide. But the tumor of the brain can happen, that is due to rapid mitosis of the neuroglial cells or the supporting cells. Okay. Next important thing is neurosis. Actually, it's a psychiatric illness. The basic definition of neurosis is still not known, but it is used in the psychiatric terms. There are two terms, neurosis and psychosis. So what is the basic difference? Neurosis refers to the illness of the mind derived from environmental cause. Best example for that is anxiety and depression. So when anxiety and depression happens, the depression is caused by external environment, right? The anxiety is due to some external environment, right? That has affected the mind of that individual. That is the meaning of neurosis. If the disease of the mind itself, that is called as psychosis. Best example, schizophrenia is an example of a psychosis. So neurosis and psychosis are two extreme ailments or two ends of a psychiatric illness. Sometimes there will be mixed. It's called neuropsychosis. We don't want that now. Neurosis means it's a psychiatric term. It refers to the environmental influence on the mind which has affected the nervous system. Best example is anxiety and depression. That's good enough. Come on to the last, neuronal plexus. So what happens? Plexus means a network. Usually a nerve, there are 31 pair of spinal nerves. They can just come straight out. But instead of that, they form a network before supplying the actual structure of the muscle or the gland. So that network of nerve is called as neuronal plexus. Best example, cervical plexus in the neck, brachial plexus in the supply the upper limb, lumbosacral plexus supplying the lower limb are the best examples of a plexus. Okay, plexus means a network. It's better called as neuronal plexus. Some people just use it as a plexus. Sometimes the capillary plexus also can be there. Vein plexus also can be there. Kindly like and share this video with your family and friends. Subscribe to my channel and press the bell button. Thank you once again.